an associate professor of microbiology at the Albany College of Pharmacy and Health Sciences here in New York. I have a longstanding interest in immunosenescence. You've heard some great terms a moment ago about immunosenescence and immunoaging, how really the immune response changes with aging. Along with that interest in aging in the immune system, I have this longstanding interest both personally and professionally in RNA viruses like influenza and COVID-19. I've really carried that interest through in my profession and my position here at the college with educating students, working with colleagues that are educating the next generation of pharmacists, but also doing a lot of outreach in New York on our local public radio station to answer a lot of questions the public had about vaccines. And that's if perhaps considering a silver lining to the COVID-19 pandemic is this interest in vaccines, interest in the immune system. So I've been very happy and fortunate to be able to help educate the public about both. So I always like to present kind of this information because I think it's broadly applicable to whatever audience I'm speaking to. And there's a quote here from the Plotkin and Mortimer book that mentions that the impact of vaccination on the health of the world's peoples is hard to exaggerate. With the exception of safe water, no other modality had such a major effect on mortality reduction and population growth. This infographic here shows again the burden of disease, and this is the United States from CDC data, but I'm sure this data is applicable throughout the globe. The burden of disease before vaccination in red, and then on the right-hand side, the darker syringes show the burden of disease after the vaccines have been put out in the public. So again, I think we can all appreciate in the audience here the very important role vaccines have played throughout medicine since their arrival. There's a number of different vaccine-preventable diseases that are important for individuals that are older. So again, older, we can consider the age of 50 or above. And in most cases, people will think 65 and older. As I get closer to 50, it pains me to think as I'm approaching these age groups. But again, it's important to think about the vaccines, at least here in the CDC, and I think globally as well, that are indicated for these populations. And I just put this here, not so much to go through this list exhaustively, but just to show that, again, considering COVID, flu, pneumococcal vaccination, and zoster vaccines, there are a number of vaccines that are, again, indicated for our older population and are part of that conversation that healthcare professionals and pharmacists and educators like myself have with members of the community. And it's not only older adults that we'll focus on in today's presentations, but again, individuals that have some pre-existing health conditions and individuals that are pregnant. So here again, a different table taken from the CDC listing the recommended vaccines for a variety of health conditions in adults. You can see it on the left-hand side here, focusing on pregnancy. As Amine mentioned, again, the importance of preventing some outcomes, bad outcomes with pregnancy through the aspects of using a vaccine. So again, just highlighting additional populations to focus on when we have these conversations in the wider community. It's important to understand that vaccine hesitancy is not an all or nothing. So it's not a yes or no. You might think of your favorite sports teams or beverages, for example, Coke versus Pepsi, right? Very distinct camps. Well, there is a continuum in the middle here for vaccines. Again, it's not all or nothing. As you can see here in this diagram, again, there's individuals that might refuse all vaccines or some, or just delay it. So we have to think about what is driving this hesitancy. These individuals typically have doubts. They may feel overwhelmed at the amount of information that's out there, what to believe. They have questions that need to be answered, and they want to figure out who is the most trusted individual to answer those questions clearly and concisely. And in some cases, they're waiting to see what their peer groups do, friends, family members, coworkers, etc. Also important too is that vaccine hesitancy is context specific. It varies with time. Right now, we're in the COVID-19 era, so there's a lot of things driving hesitancy. It can change on the place. It can change on the vaccine. So it's important to think about the context when we're thinking about effective communication strategies. It's important to understand too that individuals that get vaccinated, they still may be hesitant. So the individuals that are coming in for their yearly flu vaccine may have some hesitancy to other vaccines. So again, just stressing it's not an all or nothing game when we think about this continuum of vaccine hesitancy. Now, diving a bit deeper, I like to use this analogy of a tree. Also, an iceberg works quite well. So there's things we can see on the surface. If you think a tree here, we can see the branches, the leaves. We're getting closer to fall, very pretty color changes. But below that are the roots. And that's the same here with vaccine hesitancy. It's important to understand what is driving this hesitancy on a community level, but also on an individual level. Again, as we think about targeting these communication strategies, individuals may have had negative healthcare experiences in their past, and that's jaded their perception of anything medically related, such as vaccines. They could be influenced by their peer groups, again, coworkers, family, or friends, or social groups they're associated with on Facebook and other social media apps. Maybe that drives their perception of the world. They may have an existing lack of trust in groups such as politicians, public authorities, or medical professionals. And again, it's very difficult to break that ice, if you will. How do we get past that trust? Because a lot of the messaging for vaccines, of course, is coming through politicians, government officials, government-run facilities like the CDC, and medical professionals like doctors and pharmacists. So how do they break through that mistrust they may have in the past? Again, this is something that is somewhat found a lot in different racial and ethnic groups. They may have a sad history of health disparities, health inequities that need to be addressed before we talk about uptake of vaccines. So think about how individuals are making their decisions. Again, placing these in context as you think of how you'll deal with the community, how you'll deal with your community, how you'll deal with your patients. First off, emotions, right? Vaccination can be a very emotional decision. The individual, again, it's important to think they want what's best for themselves and their loved ones, but they have concerns. A great example is that pregnant mother. She does not want her child to become ill with a disease, but has real concerns about perhaps the safety of the vaccine. It's a very emotional decision. Am I doing what's best for my unborn child? Time's important too. The longer it takes to decide, actually, the less confident a person may be. So you really want to use direct, clear, and quick answers to their questions. If you confuse the person more or send them off to too many different sources, they may get confused and they might just say, you know what, forget it. I don't have time to get my vaccine. I'll get it next year or never at all. Unlike with some things in life, options, more is not always better. Again, choice overload. So if the individual is given too much information, too many options, again, that can become taxing both physically and mentally. So again, you want to limit the options, limit the information you're giving. Decisions are also influenced by social norms. Again, we're very behavior-driven characters. We like to follow others at times. So behaviors, attitudes, and beliefs on a community level or a society can really determine what's acceptable. So again, thinking about what is that community you're working, what are their social norms or behaviors that might have a heavy influence on whether or not a person decides to get a vaccine. Kind of group with that is the idea of herd mentality. And our groups are very important to us. So often we'll conform to the groups that we belong to, that we associate ourselves with. What I just listed here are just 8 myths that, again, I've encountered as I've gone through the community educating others about vaccines. And certainly you've seen very similar ones. And I've just listed these here as, again, thought points for things that are out in the public. People are concerned about myths and myths information they're carrying with them, and get you to think about how would you address these. We could spend a whole time and talk period about trying to address each of these myths, but again, just a general thought process here of different myths such as vaccines causing autism. Can the infant immune system handle that many vaccines? Can our immune system be overwhelmed? The idea that our natural immunity, getting sick by the disease, be it measles, mumps, or influenza or COVID, that the immunity you get naturally is much better than the vaccine. Of course, the risk there is you get disease that can have severe outcomes and it could have fatal outcomes. Concerns that vaccines contain unsafe toxins. The idea that there are other approaches such as hand sanitation, hand hygiene might do a better job. That the risk of vaccination is greater than the potential benefit. That the vaccines themselves can cause infections. If we're thinking about a live attenuated versus a killed vaccine, some misunderstandings about how vaccines are produced, how safety is tested before the vaccines are brought out into the public. And then lastly, in certain places, if the disease is unseen, think about an example for polio, for example, measles or mumps, rubella, right? We don't see the disease on a daily basis as we did, again, centuries ago. So we don't need that vaccine. The disease isn't here. I can't see it. So why should I worry about getting a vaccine or worry about the risks of vaccination? So again, just some myths that I've encountered that maybe even you in the audience have encountered too. Now, just some kind of thought, some discussions that you could have with individuals that have concerns about the safety of vaccines. Of course, vaccines in the US and globally as well are tested rigorously for their safety and their efficacy. But when we think about some of the components, people might get a little scared, kind of like when they look at the back of a food item, you're looking at the list of ingredients, and you're very concerned about calories, protein, fat, carbohydrates, et cetera. Sometimes that similar process occurs with medicines like vaccines. But it's important to note that many of the things inside the vaccines are necessary for their production and they're at very safe levels. Things like formaldehyde that are needed to detoxify and keep the vaccine safe from contaminants. The Thimerosal, again, present in some vaccines, but not all as a preservative. The use of adjuvants to improve the immune response, like aluminum. Antibiotics, again, to prevent contamination from microbes in the environment, and different stabilizers like gelatin. All these things might initially kind of concern someone thinking about the ingredients in a vaccine, but we conceptualize perception versus reality here, right? And this is a great slide that the Canadian government put forward to show, again, we think about these components, it might seem scary at first, but if you think about the different amounts, they're not as much of a concern. So for example, formaldehyde, yes, present in the vaccine to, again, keep it safe and inactivate viruses and bacteria that could contaminate the vaccine, but the amount present in the vaccine is 60-fold less than the time you might get the amount of formaldehyde you get in eating a pear. For aluminum, so the amount found in the aluminum is vastly smaller than the amount of aluminum found in baby formula or breast milk. So for that mother that's concerned about the ingredients in a vaccine, again, the vaccine components, like aluminum in particular, vastly lower than what would be found out in nature. So the role of pharmacists. Pharmacists, again, one of the important things to consider here is the amount of trust the public continues to have in pharmacists. And pharmacists continually rank in the top 5 of most trusted professionals. And right here, I've taken an image from the FIP fact sheet from 2021, listing the ranking from a variety of different countries. And again, pharmacists, as I mentioned, rank very high. And on the left here is a Gallup poll from the US showing that in the US here, pharmacists rank typically 3rd behind medical doctors and nurses, but very high in the list of trusted professionals. So that's an important fact because, again, trusted, credible source of information about vaccines and their benefits. In addition to the amount of trust that the public has in pharmacists, pharmacists tend to be the most accessible healthcare provider, that 90% of the US population is within 5 miles of a pharmacy. And I imagine globally that information may vary somewhat there, the statistics may vary, but again, globally, pharmacists are one of the most accessible healthcare providers, particularly in remote and rural areas. These pharmacists are playing very important roles in providing patient care, such as medication management, health education, and a variety of preventive services. And because of that, they typically are anchored in the community that they're working in. So they've been able to establish meaningful, lifelong connections with their different communities. So again, pharmacists position fantastically to educate and improve vaccine uptake. So this is I just wanted to focus on a couple of approaches for how we can start that conversation and improve uptake. This is a paper published in 2003 that was promoting what's called the ASPIRE model. And I think this is a fantastic job of explaining how we can improve uptake. So first, we want to assume people want to get vaccinated and be prepared for the questions that they may have. The ability to share important pieces of information to counter misinformation. But again, as I mentioned previously, don't overload. You want to be kind of targeted with that. Personal stories play a very important role. They want to relate to you as a provider, as a person. Have you experienced own doubts? How about family members? Why do you get your vaccine? So hearing from multiple trusted sources can really move that hesitancy needle. And again, because pharmacists, again, because of their trust, their accessibility, because in your training, you have a vast amount of knowledge about the what, when, and how surrounding vaccines, again, positioned greatly to move that needle. And often too, because of that accessibility and lifelong or long-lasting relationship, individuals will feel comfortable asking you questions and engaging in different conversations. And when those conversations start, again, is to respond to them and actively listen and to emphasize with the individual's concerns. So some other ways to guide these conversations is, again, to initiate and be presumptive versus participatory. What that means is you would start a conversation such as, I see you're due for your annual flu shot, rather than this open-ended question about, how do you feel about getting a shot today, or vaccines? Again, you want to go in with that presumption that they will get that vaccine when they visit the pharmacy that day when it's flu season, for example. You need to tailor that conversation to the individual's specific concerns. Again, perhaps you've established a long-lasting relationship with the individual. Perhaps you know some of their concerns ahead of time. Important to ask open-ended questions. What are you worried about? What would help you make that decision? Basically, what information do they need? Is it about efficacy? Is it about the safety? Is it about, again, the benefits of vaccination for outside of preventing disease. And importantly, to listen actively and avoid body language that might convey defensiveness or just being dismissive. Other things to think about as you engage in these conversations in your community and with your patients, empathy is very important. You already have that trust, maintain that trust with that individual. Validate their emotions and their concerns without validating the misinformation the individual might be bringing with them. Perhaps they've gotten from family, friends, or social media. Don't validate that, validate their concerns. Again, as I mentioned, kind of that attitudes, there's the stuff we see, but there's things that are driving their perception about vaccines. Address those. Provide clear and simple facts. Try to avoid overwhelming. There's a lot of great data out there, but again, remembering these individuals may not have that particular scientific or medical know-how to kind of dive through all that data. So find things that are clear, simple, clear, and concise. Importantly, to relate to the individual. Share your personal experiences if appropriate. Then lastly, you want to avoid the instinct to readily correct misperceptions. Instead, you want to pivot the conversation to the disease itself, the disease complications, and how vaccines can prevent that disease. And as we learned in our first half of this presentation, prevent many of those complications that can lead, importantly, to a fuller life.